45 million Americans are dealing with chronic gut inflammation right now, and almost every single one of them is being treated the wrong way. And I have watched the standard protocol fail patient after patient in my own office. The prescription gets written, the spicy food list gets handed over, and 6 months later, the patient is back in the same chair, in worse shape than when they left. What I am going to show you today is the protocol I actually use, not the one from the standard textbook. The one built from the research most gastroenterologists do not have time to read, combined with what I have seen work in practice over 16 years. Here is what this video covers. First, why the standard approach fails almost every time, and the specific biological reason that your gut stays inflamed. Second, the 4-phase protocol I use to drive inflammation down, and why the sequence matters as much as the individual steps. Third, the one dietary change most patients resist, but that produces the largest measurable difference in the first 14 days. Fourth, the 3 supplements with the strongest clinical evidence and how to take them correctly, because most people taking these supplements are doing it wrong. And fifth, the 80-day marker that tells you whether you are dealing with standard inflammatory dysbiosis or something deeper that needs a different approach entirely. Write this down, the 80-day marker. I'm coming back to it. And this is the single most important thing I'll say in this entire video. Gut inflammation is not a condition, it is a signal. And if you treat the signal without finding the source, you will be managing this for the rest of your life. And the single thread that runs through almost every chronic inflammatory case I have seen is this. The patient was given a treatment for their symptoms, without ever being given an explanation of what was actually driving those symptoms. Nobody sat down with them and decoded the signal. They were just managed. That stops today. Let me tell you about one of my patients. I'll call him David. He was 42, an architect from Leeds, and he had been dealing with what his previous doctor called irritable bowel syndrome for 7 years. 7 years of bloating so severe that by 3 in the afternoon he looked 4 months pregnant. 7 years of fatigue that he had started blaming on his job, on stress, on getting older. His doctor had tried him on 3 different antispasmodic medications. None of them had worked for more than 6 weeks. When David came to see me, the first thing I told him was that his problem was not his bowel. His problem was his immune system. His gut wasn't irritable. His gut was on fire. And that distinction matters more than most people realize. Irritable bowel syndrome is a functional diagnosis, which means it is what doctors say when they cannot find a structural cause. In David's case, when we ran the right tests, we found significantly elevated calprotectin levels in his stool, which is a direct marker of intestinal inflammation. We found elevated zonulin, which indicated a compromised gut lining. And we found a bacterial profile in his microbiome that was almost completely dominated by 2 species that produce lipopolysaccharides, which are the specific compounds that activate the immune response responsible for chronic gut inflammation. David did not have irritable bowel syndrome. David had chronic low-grade intestinal inflammation that had never been correctly identified, because a standard gut workup doesn't routinely test for any of these markers. But within 60 days on the protocol I'm about to walk you through, David's calprotectin had dropped by 63%. The bloating he'd lived with for years was gone by week 3. His fatigue, which he had spent 7 years blaming on his career, cleared by week 6. At his 4-month follow-up, his bacterial profile had shifted to a point where the inflammatory species represented less than 15% of his total gut flora, down from over 60%. I am telling you David's story because I want you to understand something before we get into the protocol. The reason most approaches to gut inflammation fail is not that the treatments are wrong. It is that the sequence is wrong. Most protocols try to reduce inflammation before they have addressed the source of the inflammation. That is the equivalent of trying to mop water off your floor while the tap is still running. The source is almost always one of 3 things. Either the gut lining is compromised, meaning undigested food particles and bacterial compounds are leaking through the intestinal wall and triggering a continuous immune response. Or the bacterial balance in the microbiome has shifted towards species that produce pro-inflammatory compounds, or both at once. In my clinical experience, it's both in roughly 70% of the chronic cases I see. That's the foundation everything else is built on. Phase 1 does not fight inflammation. Phase 1 stops the fire from being fed. Phase 1 duration, 14 days. Goal, remove the primary inflammatory triggers. There are 4 dietary compounds that, in the majority of patients with chronic gut inflammation, function as direct inflammatory accelerants. Refined seed oils, particularly those high in omega-6 fatty acids, including sunflower oil, soybean oil, and corn oil, Refined fructose, meaning added sugars and high fructose corn syrup, not the fructose in whole fruit. Emulsifiers, specifically carboxymethylcellulose and polysorbate 80, which are found in the majority of processed foods, and which the research published in the journal Nature in 2015 showed directly disrupt the mucosal layer of the gut. And alcohol, which is dose-dependent, but at any chronic intake level, increases gut permeability within 72 hours of consumption. 14 days. Remove all four. Not reduce. Remove. I know this is the part most patients resist. I'm not asking you to live this way forever. I'm asking you to hold to it long enough for phase 2 to do its job. Because if you're still feeding the inflammatory cascade while you are trying to repair the gut lining, you are working against yourself from day one. The dietary change that makes the largest single difference in the first 14 days is the removal of refined seed oils. Not because they are the most inflammatory compound in isolation, but because they are the most hidden. Most people know they are consuming sugar. Almost nobody knows that the salad dressing they pour on their lunch, the cooking spray they use every morning, and the protein bar they eat after the gym are all delivering concentrations of omega-6 fatty acids that push the omega-6 to omega-3 ratio in their cells to 20:1 or higher. The optimal ratio for gut immune function is 4:1. When you are at 20:1, your immune cells are primed to stay in an inflammatory state, regardless of what else you do. Replace seed oils with extra virgin olive oil, grass-fed butter, and coconut oil for 14 days. That is the single fastest acting dietary intervention in phase 1. Phase 2, duration, days 15 through 42. Goal, repair the gut lining. The gut lining is a single layer of cells called enterocytes. It is thinner than a sheet of paper, and it is your body's primary barrier between the external environment and your bloodstream. When it is compromised, everything that was never supposed to cross that barrier starts crossing it, and your immune system responds to every crossing as a threat. 3 compounds have the strongest clinical evidence for supporting enterocyte repair and restoring tight junction function. Tight junctions are the protein structures that hold enterocytes together and determine how permeable the gut lining is. The first is L-glutamine. Glutamine is the primary fuel source for enterocytes. Without adequate glutamine, the cells that make up your gut lining cannot replicate or repair at the rate needed to close a compromised barrier. The clinical dose that appears in the research is 5 grams taken on an empty stomach twice daily. Most people throw glutamine into a post-workout shake and call it done. That's not how it reaches the gut lining in any meaningful concentration. Empty stomach, dissolved in water, morning and evening. The second is zinc carnosine. This is a specific chelated form of zinc, not standard zinc sulfate or zinc gluconate. The chelated form has been shown in multiple trials to stabilize the gut mucosal layer and reduce the rate of tight junction degradation. The clinical dose is 75 milligrams once daily with food. This is not a supplement you will find at a general health shop in this formulation. You are looking specifically for zinc L-carnosine or zinc carnosine on the label. The third is colostrum. Bovine colostrum contains immunoglobulins and growth factors, specifically insulin-like growth factor 1 and transforming growth factor beta, that support the regeneration of the intestinal lining. The evidence here is particularly strong for athletes and for individuals who have been on non-steroidal anti-inflammatory drugs for extended periods, both of which cause measurable gut lining damage. The clinical dose is 2 to 4 grams daily, taken away from meals. Phase 2 runs for 28 days. Do not skip to phase 3 early. The gut lining takes time to repair, and the repair is not linear. Most patients see symptomatic improvement in week 2 or 3 of phase 2, feel better, and stop. That is the most common mistake. The repair that determines your long-term outcome is happening in weeks 3 and 4, after the symptoms have already improved. Phase 3, duration, days 43 through 70. Goal, rebuild the microbiome. This is where most gut health advice starts, and that is why most gut health advice fails. If you introduce probiotic bacteria into a gut environment that is still inflamed and still has a compromised lining, those bacteria are not going to survive long enough to colonize. You are seeding a garden that is still on fire. By the time you reach day 43 of this protocol, the fire has been brought down, and the soil has been prepared. Now you plant. The 3 categories you need in phase 3 are fermented foods, prebiotic fiber, and a targeted probiotic containing the specific strains with clinical evidence for inflammatory conditions. On fermented foods, 2 to 3 servings daily. Good options include plain unsweetened kefir, kimchi, sauerkraut with live cultures, and plain Greek yogurt with no added sugar or thickeners. If dairy doesn't work for you, coconut milk kefir or water kefir are solid alternatives. The goal is live bacterial diversity coming from food, not from a single capsule. On prebiotic fiber, the specific type matters. You are targeting inulin-type fructans, which are found in highest concentration. These are the fermentable fibers that the bacterial species associated with reduced inflammation preferentially consume. Introduce them slowly. If you add too much fermentable fiber too fast, you're gonna feel it. Gas, bloating, some real discomfort. That's actually a sign of rapid bacterial fermentation. It means something is working, not that something is wrong. Start with 1 serving a day and build from there over 2 weeks. For probiotics, the strains with the strongest evidence behind them for gut inflammation are Lactobacillus rhamnosus GG, Bifidobacterium longum, and Lactobacillus plantarum. You want a product that lists these strains by name, with CFU counts of at least 10 billion at time of use, not at time of manufacture. Refrigerated formulations are generally more viable than shelf-stable capsules. Take them with the first bite of your largest meal of the day. Phase 4, duration day 71 onward. Goal, sustain. Phase 4 is not a phase. Phase 4 is the rest of your life. But it is not as demanding as the first 3 phases. The maintenance model I give patients has 3 rules. First, the seed oils stay out, not because a single exposure causes acute harm, but because the chronic accumulation of omega-6 inflammatory load is what got you here. 1 meal cooked in sunflower oil isn't going to undo your progress. Eating it every single day is what brought you here in the first place. Second, 1 to 2 servings of fermented food daily, maintained indefinitely. The microbiome is not a fixed state. It shifts continuously based on what you eat. If you stop feeding the beneficial species, the inflammatory species fill that space back in within weeks. Third, sleep. I am listing this here because it belongs here. 7 to 9 hours of sleep per night is not a lifestyle recommendation. It is an intestinal inflammation management tool. Sleep deprivation elevates intestinal permeability measurably within 48 hours. If you are sleeping 5 or 6 hours and wondering why your gut keeps coming back to inflammation, now you have the answer. And now I need to talk to you about the 8th day marker. Because this is the one piece of this protocol that most educational content about gut inflammation does not include, and it is the most important. If you complete phases 1, 2, and 3 correctly, the majority of patients will be symptom-free or significantly improved by day 80. If you are not significantly improved by day 80, you are not dealing with garden variety inflammatory dysbiosis. You're looking at something in one of 3 other categories. The first is autoimmune. Conditions like Crohn's and ulcerative colitis need medical management, the kind that goes well beyond any nutritional protocol. If your inflammation isn't responding to this approach, you need a formal clinical diagnosis. The second possibility is small intestinal bacterial overgrowth, SIBO growth, which requires a breath test to diagnose and a completely different treatment protocol. The third is a food sensitivity that is still active, most commonly to gluten or to casein and dairy, that is maintaining the immune response despite everything else being correct. Day 80 is your checkpoint. If you hit it with significant improvement, you continue into phase 4. If you do not, you book an appointment with a gastroenterologist. You bring your food diary and you ask specifically about these 3 diagnostic categories, not about your symptoms in general, about these 3 specific possibilities. I want to be clear about this. Nothing in this video replaces a clinical evaluation. What I am giving you is a framework for understanding what to look for and what questions to ask. Your physician needs to be part of this conversation. Here is what 16 years of watching this play out has taught me. Your gut is not failing you. Your gut is responding perfectly to the environment you have been giving it. The inflammation is not a malfunction. It is the correct response to incorrect inputs. The patients I have watched fail to recover from chronic gut inflammation almost always have one thing in common. They approached it as a condition to manage rather than a signal to decode. They took the medication, avoided the spicy food, and waited for their body to fix itself. Your body cannot repair what it's still being asked to generate. The patients I've seen recover fully cons. They take a completely different approach. They ask why, they track down the source, and then they cut it off. If this protocol gave you a clearer picture of what's actually going on in your own body, if you know someone who has been struggling with chronic bloating, fatigue, or gut discomfort for years without getting a clear answer, share this video with them. Not because it'll fix everything overnight decline, but because knowing the source is always where real recovery begins. Subscribe if you want the follow-up video I am releasing on the specific lab tests you should ask your doctor to run and what the numbers actually mean. Because the reference ranges printed on standard lab reports are population averages, not optimal health targets.